Yesterday was so great, you guys.
Mhm.
Really, really well done.
Awesome. Well, good morning, and welcome back. I would agree with Carol's assessment that yesterday was a fabulous start to our session. I think those of you that were able to be there, hopefully everybody had a good night's rest and able to absorb and let a bunch of those ideas sink in. We are not going to waste a whole lot of time with introductions and things. We're going to jump right in here this morning. Before we get started, though, I do want to thank once again our gold sponsor, Rehab Essentials. And we're going to jump right in to our first topic, teaching with AI. We are very fortunate that Laurel Abrazizi is going to be our facilitator. And so I'm going to turn it over to Laurel.
Good morning. We have full bios on all three of our Teaching with AI speakers, which I put the link in the chat for you. So we're just going to jump right in with our first speaker so we don't eat up her time. Kaelee Brockway will be our first. Take it away, Kaelee.
Thank you, Laurel. All right. So Karen, you're at the top of my screen. Can you let me know if you see my screen?
There it is.
Good.
Yes.
All right. Lovely. Fantastic. Okay. So today I'm going to be talking about using chat GPTs, custom GPTs in healthcare education and all of the various ways that we might be able to use this very interesting tool to help us just be more efficient in the things that we need to do, but also explore a whole bunch of new ways of doing what we've already been doing. So just kind of a little bit about me to start, just in case, you don't want to head over and read the bio. This is going to be very brief, I promise. My career has been a huge blend of hands-on experience and kind of more forward-thinking exploration when it comes to tech. I am by nature a very low-tech person. I'm a home health therapist by background, which means I'm used to doing everything with nothing. And when it comes to high-tech stuff, I kind of shy away because that's probably not going to be in my home health bag or in the trunk of my car. So when it comes to AI, though, the great thing about AI is the portability. And when I transitioned into full-time education, I was able to really look at how tech could help me be more efficient at getting my students to learn what I wanted them to learn, but also value what I needed them to value. So I started off looking at AI as a QI project, really about improving our admissions and teaching AI all about the master adaptive learner and all of the things that we wanted in our students so that we could kind of filter through our admissions process and identify the students who had a really good master adaptive learner type mindset to come into our program. And I integrate some AI in simulation, which we're going to talk about. And kind of at the heart of all of this, I'm a very busy mom of twin 7-year-old boys who never stop moving and never stop just doing everything. So I don't have time for anything. So I have to be super efficient with what I do at home as well. And I use AI constantly at home, whether it's to plan my dinners for the week or to, just give me a summary of the things that I need without having to go look everything up. And custom GPTs are a really nice way of facilitating that process and making it even faster than using a generic GPT alone. So then let's really look at what is a GPT? And Dr. Pusik addressed it yesterday, but GPT is an acronym that stands for Generative Pre-trained Transformer. So you can see that there on the screen. And they can be two versions. They can be generic or general, which is what ChatGPT is, that's what Gemini is, or they can be customized. And customized GPTs are trained on a base data set that is what you define it to be, and it's a very fixed data set, meaning that the outputs have a very fixed purpose. And we'll look at some of these as we go through the presentation. These can use a base large language model to help facilitate their outputs and make them more human language friendly, but sometimes the base language model is something you can choose, and sometimes it's a fixed base model. It depends on the GPT builder that you're using. And we're going to look at a couple different versions of that as well. So by training chat or GPTs, I'm so used to like chat GPT because it's just so like second nature language at this point. But by training a GPT on curated domain specific data sets or specific scholarly articles, or even specific research papers, or some of my favorites, institutional policies and procedures, so that I don't have to repeat the student handbook to my students, they can just ask the AI already trained to do that, their questions. We can have the appearance of a really deep expertise without having to have all of that knowledge in our heads. I don't know about y'all, but I don't have the student handbook memorized. I don't have the faculty handbook memorized, but the AI doesn't need to memorize it, right? It's all there ready to go, and it can just reflect upon that information to answer any questions asked of it. So this special training of a GPT kind of limits the production of the hallucinations or that fake representation of information that is randomly generated by these LLMs. And also the information that it puts out is so much more precise because it's drawing from a very fixed base data set. For researchers, this can translate to really accelerated information retrieval and analysis, and can seriously streamline your literature review process, and set your data up for synthesis for you in a very easy way. From a pedagogical standpoint, though, custom GPTs can automate the creation of personalized learning materials. And this goes back to some of the things that Dr. Pusik talked about yesterday about customized learning, and Dr. Masters talked about that as well, where you can really generate customized learning materials based on the fixed data set that you give the GPT model, so that a student can take what you've taught and turn it into whatever tool they find best fits their needs as a learner. These models can also be integrated into existing learning management systems, which is something I have done in our courses at our institution. We have several different role play GPTs that I've created that are built into our LMS, and our students interact with those for various different reasons, depending on the one they choose. And they're also can be a little bit safer too, because if you are leveraging some proprietary research or some proprietary information, your built-in LMS GPTs hold all of that security for you because they hold the same security as your LMS. So you don't have to worry about, you're throwing all of your proprietary information into ChatGPT, into the world of the AI bot, and worrying about how that's going to influence the outputs in other people's systems. So the essence really is that custom GPTs provide a scalable solution for knowledge distillation. So we can kind of take things down from where they started to provide that more personalized learning environment and kind of some research acceleration for the faculty without demanding more resources of your time, which we already have so limited time to start with. So let's talk about some specifics. How can you use custom GPTs to improve your work efficiency and your students' learning efficiency in your program? And the great part about this is that there are so many ways that you can do this. So Dr. Pusik covered some of these yesterday, as did Dr. Masters, but I wanted to give some specifics on how I use these specific roles of a GPT. So imagine a university environment where learning is truly tailored to each student's individual needs, where you can take your research from 2 years to put together a manuscript to 2 months. This is not a distant dream. This is the potential of what we have right now in these custom GPTs in our academic ecosystems. Students facing challenges with specific concepts can access their GPT as a private tutor available 24/7 so that you don't have to be answering their emails Friday at 7:30 p.m. The private tutor is one of my favorite roles of a GPT, but I also think it's the least utilized, especially by students. They can, and I'm going to give an example of this. We're going to run an actual scenario to have GPT be our private tutor here in a minute, but we can take the transcripts from our presentations or the presentations themselves, put them into a GPT that is set up to have the persona and the data set of a private tutor for a student in a DPT program. And we can have it generate questions, quiz questions, multiple choice questions, discussion topics. And that way the student can really dive into that information in a conversational manner, in a way that makes sense for them. It's like they're getting their own private lecturer almost, that can sit there and answer their questions directly. And one of the other ways I love to use this is I meet with a lot of students. I teach cardiopulm, so my students need a lot of one-to-one time to kind of cover some of that information. And I give them all action steps. And so I like to see that they're going to turn those meeting notes that they've been writing into actual things that they can go back and do to help enhance their understanding of the material. So I like to have them put their meeting notes that they're taking into the GPT and have them turn it then into action steps that they can come back the next week and say, okay, here's what I did. So giving them a little bit more accountability for their learning, I think, is a great role of this private tutor. The universal design integration is really important here. And I think that for those of us that use various LMSs, the universal design integration in an LMS is different depending on your LMS. And as an educator, we don't necessarily have all the time in the world to look at the universal design components of what we're uploading, what we're creating, what we're teaching. And not everybody has access to an instructional designer that can go back and take care of some of these things for you. So when you're creating your educational materials, you can actually have a custom GPT that has the persona of an instructional designer, and an instructional designer that specializes in universal design, that can increase the accessibility of all of the things that we teach to a variety of student levels. So this custom GPT can take in your learning materials and it can say, all right, we need to change this lecture to use different wording at a different grade level so that this is more accessible, or we need to add tags to this PDF so that students with visual impairment can access this better. And it can give you a lot more ideas on how to make your content accessible in a universal design way without having to elicit the services of an additional instructional designer if that's not something that you have access to at your institution. The research assistant role is, I feel like this is the obvious one when it comes to custom GPT use. I have a research assistant bot on my phone, and this research assistant bot does all kinds of things for me. From I put in the text of a manuscript and it'll create the abstract for me with all of the various parameters that each journal might require. So if I'm resubmitting to a few different journals, I can have an abstract that fits each parameter without having to go back and reconstruct every single thing that I have spent all this time doing. I can also have it write, a lot of journals like to have the key points now with their submissions, so I can have it come up with those key points for me. And also within the word and character limit, because some of them only allow you 50 characters or 100 characters per key point. And I can also have it start to generate some ideas for visuals. So obviously, as we saw yesterday, the visuals generation, the image generation is not really up to a usable level yet when it comes to scientific images that require labels and wording, because all the wording, like Dr. Pusick said, was gibberish. But it can at least start the idea process off. A lot of journals now are wanting you to submit visual abstracts, and visual abstracts can be really interesting and exciting and really draw readers in, but it is tough when you've spent all of your career just coming up with the words to then converting that into something that is an image. So the research assistant helps with that, as well as all of the stuff that takes a lot of our time, like setting our data up for easier analysis and even translating studies in different languages for us. And one of the things that my research assistant does for me all the time, which seems a bit silly, but I don't have a student worker or a graduate assistant, is it just arranges things in a printable arrangement for me. So I don't have to go back and rearrange all of my documents to be in the way I want them printed. It takes care of all of that. Saves me quite a bit of time. Now I just need one that can run a laminator and I'll be in good shape. I haven't figured that out just yet though. One of the things that we have our students do with our GPT personas built into our LMS that I've designed is practicing their soft skills. So we do quite a bit of interprofessional as well as intra-professional communication. And the personas have specific goals that they're willing to let the student achieve through various means. And the students have to get pretty creative sometimes with how they achieve those goals. And I love to see their personalities come through in those conversations on the back end of the LMS. And the copy editor is a really great use for academicians. We can generate reports. It can create our gradebook spreadsheets for us if we need it to. It can even take lectures, outline the PowerPoint that would go with the lecture, and then it create the initial PowerPoint outline for us so that we have kind of that first draft. And this allows us to really focus on why we're there, right? Which is to educate, not to do all this other background administrative stuff. So where can you find custom GPTs? Well, the good news is that there are a lot of them already out there, already built for you, excuse me, for various reasons. So I have a few listed here that I have used and continue to use. So ChatGPT has one that is specific to universal design. I've included a QR code for each of these for you if you want to look at them. The universal design one is really, really good. It is very creative too in how it modifies learning materials. Poe is another one of my favorite GPT builders, where you actually have 4 different types of GPTs you can create. And my favorite one to do is the role play one. So you actually give the bot a persona, a background, an identity, and the students can then engage with that bot. I've given y'all the access to Bart, who is an EMT that I created that is from my actual clinical practice, where I had to kind of convince an EMT that my patient did need emergency services and needed to go to the hospital. So that's the scenario I set up for the students to achieve as well. And then Gemini Coach is the Google-based custom GPT, and the Learning Coach is really, really effective. And it really helps students break down information in really interesting ways that improve their understanding of lots of different topics. You just have to tell it what level of learning you're at and what topic you're learning. And you can also then provide it with your course materials and anything else that you've given the students, and it will kind of put together their study guides for them and help them learn the information. Now, there are definitely a lot of other examples of places where you can build your own custom GPTs. If you don't want to use any of these, just feel free to ask ChatGPT how you can build a custom GPT, and it will give you lots of different options on how to do that. And now let's take just a quick look at what this actually looks like. Okay, so I'm going to stop sharing my screen real quick and go back to a different share here. So this is a little bit of a different thing. So you all heard about Notebook LM yesterday, and Notebook LM is not necessarily a custom GPT. It's got a built-in foundational language model, which is Gemini. But what you can do is you can program it exactly the way that you want to program it with your base data set, which I'm just going to pull from my desktop if I can find it. There we go. Too many screens open. Okay.
You know
Okay.
that? Okay.
Yep, got it. Okay, so You can pull a document from your base data set, whatever that happens to be, if it's a transcript of your lectures or something like that. I am going to give it the transcript from my lecture on cardiovascular conditions in athletes. And of course, I'm going to spell it wrong because I have people watching me. There we go. All right, so it's going to pull this in. And the way that Notebook LLM is a custom GPT is that it is custom programmed to only put out certain outputs. So what I love about this is now that it has this information, the students can engage with the material. Can you create 10 quiz questions about this for me? And Gemini will do that. So it's set up to build that kind of environment. And these are all multiple choice. These are pretty decent quiz questions based on previous runs. But it can also manipulate the input content to be more suited to the students' learning needs. So if I were to say, create a podcast with this information, all I have to do is hit generate, and it takes a few minutes, and it will actually turn all of this material into a podcast. And this is not a crappy podcast. This is a good podcast that is actually interesting to listen to. I can have it create a study guide and an FAQ document. I can have it create a briefing, just a summary of the entire presentation, and it will create all of these learning materials for the student to download simply, easily, with literally just a few clicks. They put very little time and effort in. So when your students are then asking you, well, can we study guide for this? My more recent answer has been no. I'm not going to give you a study guide. Go make your own study guide. You have all the resources out there to do that. So these custom GPTs can do that building for us. And then I also just have some resources here in case y'all are interested of some other custom GPTs that I use very regularly. SciSpace is a research AI assistant, which can like keep a search running for you at all times on a certain topic. AI Studio is where you can go and kind of build some custom GPTs for yourself. And then MedPalm is kind of the medical differential diagnosis GPT, and Palm M is the new, more advanced version coming out, which will actually read all your images, take in your chart notes, all of that. It's only in beta test right now, so it's not publicly available, but it is coming very, very soon. And then getting here was kind of a process of practice, but taking some courses on some AI essential information was really helpful. And I did that on Coursera, so I'd highly recommend some of their AI courses as well. And that is how we can use custom GPTs to help improve our education.
Thank you so much, Kaelee. That was fabulous to see all of the ways that you are using AI in your teaching. We will have a chance to talk about your work and your discussion prompts in a little bit, but right now I'm going to move us right along to our next speaker, which is Kathleen Fortier. And just as a reminder to all of those who are here, if you came in late, the full bios for our speakers are available on the PTI website, and I'll put a link in the chat. Take it away, Kathleen.
All right. Well, thank you so much. And good morning to everybody. So I don't know about you, but I am so excited to be here. And I've been delightfully inspired really by our keynote speakers yesterday evening, and then more so even just by Kaelee. As Kaelee, I use GPTs very similarly to you. And some of the things that you're going to hear, and this, I promise you, we did not rehearse this, is I'm hearing just so many different great themes of the why. So, why we utilize GPTs. So efficiency, I heard value, I heard master adaptive learner, and I heard time. Okay, so these are all reasons why I started to use AI. And so before I get started, I would like to also just report that I have no financial disclosures. However, I might say the word "so" enough times to make someone rich throughout my presentation. So bear with me. Then just quickly, how I begun my work in AI was solely motivated by my curiosity on how we can really be the best versions of ourselves as teachers, how our students can be the best versions of themselves, really as learners and future healthcare providers, and how together we can really advance and transform healthcare delivery one patient at a time. So I also have an economist style of thinking, and know that we only have so much time, right? Time is a non-renewable source or resource that we have, and we're living in such a society with so many more demands on our time. And Kaelee, Kaelee introduced that just so beautifully. So I've really begun to embrace AI as a tool. And when utilized well, it's something we can really minimize the mundane and really put an accelerant on our progress forward. So before continuing through this presentation, I would also like to just acknowledge that I will not necessarily be discussing AI literacy, which in my opinion is probably the first place, if you've never used AI, is a great place to just begin. And Kaelee gave some great resources with Coursera. That it's really the foundation for us to use AI ethically. And as I've heard it said, and it's stuck with me in another presentation, is that AI in and of itself is not ethical or unethical. It's the person really behind the AI that is either ethical or unethical. So without further ado, I'd like to dive in. So my primary role at Arcadia is clinical education. And I'm also an assistant professor of practice, mainly teaching in the healthcare management and leadership's realm. So I'm looking forward to hearing more about how further AI is being used out there in the clinic. And I know that this has been happening in medical education, as well as our insurers have been using AI for practice. So it's about time we start getting smarter, right? So really, clinical education for me is about developing the student and the clinician's critical thinking. The development really starts even before they enter the clinic, as students really should be demonstrating some appropriate competencies, particularly in those affective, cognitive, and psychomotor domains. So while they're in our clinics with our teaching faculty, they're really bridging the gap between theory and practice, which further requires tutoring, coaching, and mentoring. So along the student clinician's journey to really master these domains. So critical thinking requires many skills and abilities. So we're going to just refresh ourselves in that. And I just have a little quick graphic here. Some of you may notice this from Plack and Driscoll. These are the skills needed for critical thinking. So we have self-regulation, explanation or communication, inference, evaluation, analysis, and interpretation. And so over the years, many of our great master clinicians, we start to use these reflexively. And we have repetition over and over and over again, which calibrates our results for learning and has really evolved our learning. And our other thought leaders, particularly with the massive adaptive learner frameworks, really say that each graduate must have these skills and mindsets to adapt to our rapid advances in science and practice. And really to produce this master adaptive learner, critical thinking and reflection are really crucial for our learners to acquire and kind of experience. So we know that traditional teaching methods tend to struggle to provide personalized support, as Kaelee also mentioned, and same with Ken, and instantaneous feedback. And we can't simply ignore the affective and attitudinal aspects of our critical thinking, particularly in today's student learners. So as one can see here, we need to really think about where our students are. And we know that our students struggle with "it depends" in medicine, and we have cultivated this mindset throughout their learning, over the umpteen years we've been in this teaching realm. However, I don't know about you, but I've also really noticed a difference in our students. And I'm sure we can all really attest to at some point this toleration of ambiguity and the affective aspects required for critical thinking are really seemingly more challenged in today's student. So usually in order to figure out how we intervene, we really kind of need to know the why. I'm going to briefly try to touch upon this, but my passion and why I started using AI was because we found our students are needing really to be grounded and developed and with these skills. So they're not coming in with as many same baseline skills that we really need as years ago. So for some, if not for most students, they have had less social interaction and fewer personal or professional opportunities. I will say that having teenagers, I can absolutely attest to this because my 13-year-old is desiring to get out there and volunteer and get involved with different organizations. And simply no one wants to take a 13-year-old under their wing as a volunteer. Whereas when I reflect back at 13, I was taking care of children under the age of 5, and I was volunteering at hospitals. And that's kind of what grew me into a physical therapist today. So for most physical therapy students at this point, they are digitally savvy, and we're definitely seeing that prior to PT school. We're also seeing just some minimal exposure to varied PT settings, and that kind of then goes into this relation to discomfort in selecting diverse clinical education experiences. And while that has come from a little bit of our COVID pandemic, this also is just because of just who our students are and the society that they grew up in. So our impact on their affective domain from all of this and the society they grew up with is that relationships are not considered safe, which we know is the foundation to relationship and communication. So conversations are most often more transactional and not open-ended. They do desire instantaneous feedback because that's what they've grown up with. They require training in both accepting and seeking constructive feedback, again, because to be corrected or given feedback is not safe and is like a trigger alarm. And we also know by research studies that delayed development of the prefrontal cortex in our students is being impacted. So self-awareness, social skills and comfort, communication and problem solving aren't quite at the levels that we used to. So we know that this will really impact therapeutic alliance, which is scary to me because therapeutic alliance is truly the foundation for getting the information that we absolutely need for proper clinical decision making. So this bi-directional flow in conversation, when done correctly, really involves building these relationships. So looking at our faculty, as Kaelee said, we have less time, and I told you I'm kind of a more economist type thinker. So ultimately having higher demands for developing these students in a quicker time frame. And in that affective domain is really important. So enter the world of AI to help us. So we've utilized generative AI, and so I do use a little bit of the custom GPTs, but we've used over the years. If you've been in clinical education for any length of time, we've typically used simulations. And so they are labor intensive. We've used standardized patients to try and give feedback. But again, these are expensive and often labor intensive, time intensive. So while in medical education, we're not talking necessarily about getting rid of these, we're actually looking to, I would say, enhance the teaching and learning with these. And generative AI can begin to offer us some alternatives. So the rest of the presentation, I will describe the uses that we use with AI in our entry-level clinical education courses to have our students really have the opportunity to practice clinical decision-making and affective domain skills to really level them up. So I know I said I wouldn't delve also into some AI literacy, but if you take away anything as you are learning about AI, Malik and Malik are two professors out of the University of Pennsylvania. put out a paper about the 7 approaches to AI in education back in 2023. And so this is a table about those 7 approaches. I will be using examples today from 3 of these AI uses. So in clinical education, we've talked about mentoring, coaching, and simulation. So the purpose of simulation really is to have deliberate practice and application, which kind of promotes that transfer of knowledge base. So as faculty, we're consistently assessing our students' skills and abilities in doing this. So when I look at feedback forms, weekly goal sheets of our students, I often see this. I want more practice. I need more practice in order to master these skills. And they don't always have those opportunities. So with generative AI, I utilize this as a resource. So if you can recall also, the pedagogical risk in using AI as a simulator is a little bit of that inappropriate infidelity. However, if your students are really grounded in their knowledge and have appropriate AI literacy, you can really minimize that risk and really accelerate their learning. So in this and all of my examples, most of my examples thus far will be just utilizing ChatGPT, both the free versions and paid versions. So they are more generalized, but do a really decent job. So this is an example. I had a student that really was struggling with prognosis, and we just asked ChatGPT to, I want to practice my prognosis skills with physical therapy scenarios. This is the scenario it spit out, and the student was able to have various conversations and with ChatGPT in practicing this, and it gave them feedback, which was excellent, actually. The second example, aside from some of that, is coaching. So we are constantly being coaches. So there's a lot of research coming out in terms of behavioral coaching with the use of AI. So if you're really interested in this body of work, I would certainly head over to access that kind of research. And ultimately, using AI as a coach is really building on the theory that learning requires motivation, self-regulation. And they must be motivated to really put in the work to make sense of new ideas. Our students also need to consistently monitor and regulate their own thinking and learning, which again is a little bit more delayed. And so we need to give them more opportunities for practice and feedback. So we've long recognized the importance of metacognition and self-monitoring to deepen their understanding and change their behavior. So while any experience is tied to the present moment, really we want to extract the lessons to experience a plan and move them forward. So we really, in today's student learner, as we know that they're behind, they also have this kind of transactional and not translational sort of experience. In clinical education, we've utilized reflective journaling for the development of this. However, one of the things I'm noticing is it's just enforcing this transactional approach. So they're having a difficult time actually producing reflection. And so when I respond to them, in our LMS, I'm asking them more probing questions, which is trying to promote this conversation. So what we're going to start to do and what we're working on is actually turning a one-directional reflective journal into a conversation with a GPT. And so ultimately, the beautiful part about this is you can use the free or the paid versions. There is a button in ChatGPT where students can share the conversation, upload it into the LMS, and now my time is being spent evaluating how the student is doing in their reflecting versus giving them further reflection points and trying to refine them. This is another prompt that we tested out. There was a conversation myself and my other DCE had with a student that has significantly challenging affective domain behaviors. And the conversation took about 45 minutes. And we afterwards were like, I wonder what ChatGPT would say or how they would do in being a coach. So she has the free version and I have the paid version. So we sat and we did it. We both played the role of a student in our respective areas. And it was crazy how the chat GPT acted as a coach and said almost the exact same things as we did through that 45-minute conversation. And so that's a little scary in and of itself, because I don't know whether that means I'm a good coach or a bad coach, but that's to be determined later. And lastly, one of the things that we embed is both an attaching simulator and coach together. And so this is two examples I have. One is that they are working on some clinical decision making, moving from that subjective portion of their evaluation into the physical examination. And they also share the conversation, so we can actually be giving them feedback on their interaction. So it's a little less about their clinical decision making, particularly early on, but you can certainly refine that. And we minimize the pedagogical risk by really having them also then reflect and delve further. So the actual assignment that they're being graded on is more about that conversation, not did they get the right answer. This is another one that we use that I find it's very fun. It's practicing that discharge conversation, which tends to always be really awkward. And again, it's what would you do differently in your future encounters, and what would you continue to do, and how that conversation went. And then lastly, for you as a teacher, as your AI literacy just becomes greater, I would say, delving into, things like Poe, as Kaelee said. These are further chatbots, and this is a chatbot we created that was of a more difficult patient, and in a hospital scenario, because we know that our students struggle with, what's coming next at them. So Kaelee highlighted the use of Poe. So also, if you want, there's a QR code you can interact with our difficult inpatient patients. So like all my presentations, I try to pack a lot into little time. So just here are my key takeaways. Teaching and learning is different in today's environment, and emerging technologies and tools really make it possible to navigate these differences. To really foster that growth in communication, clinical reasoning, and professional behaviors, we've seen AI assignments to start to accelerate that. We did a small pilot group of students, and on their first clinical, they really showed improvement, particularly on CPI criteria within the areas of communication. On the CPI criteria in a group that had these opportunities versus a group that didn't. So I really just want to say that we also need further research for really defining the effect of using this tool in improving affective domain behaviors and development. So if anyone would love to jump in on this, we are always looking to partner with other folks who are interested to really see and determine these effect sizes. So AI, generative AI in particular, should really be viewed as our partner in clinical education, not necessarily a replacement in clinical education.
Thank you so much, Kathleen. That was a wonderful overview of how you're using AI in clinical education. I'm definitely going to borrow the reflection activities. Thank you so much. As I said before, we'll have a chance to talk more about your themes in a little bit. We have one more speaker that will be presenting on teaching with AI. Our next speaker is Scarlett Morris, and she should get spotlighted. Excellent. Take it away, Scarlett.
All right, thank you so much. I believe you're seeing the correct screen. Just please let me know if anything isn't correct, but we'll get going here. So thanks for having me, and thanks to Kaelee and Kathleen for getting things kicked off this morning. And I hope that what I present what I present really kind of complements what they've already discussed. There are some similarities, but I want to dive into a few examples and ways that I've utilized it and we've utilized it at KU Med. So a little bit about me. I am a PT educator at KU Medical Center. I am primarily teach within the ortho track here, and I am the director of curriculum, didactic curriculum, and labs. And I'm going to focus a little bit more about teaching with AI and how it can empower students' clinical reasoning. And so this, I hope, sparks your interest. And so let's go ahead and dive in here. I'm going to start with a little bit of my why for utilizing AI and my interest in it and the opportunities that I think it has for us as educators. I'll talk about an example of an individualized study plan for a student, and I know that's already been mentioned, so I'll just kind of hit the highlights that might be a little bit different than what's already been presented. I want to give you an example of a subjective exam assignment that we've done, and also example of a feedback for students from an example of an actual feedback a student had from an OSCE that could be AI generated. We didn't take it to this level, but I'll hopefully use that as a way to show you kind of the full potential, and then just quickly share some takeaways or golden nuggets, as we like to call it. And just as a disclaimer, or kind of as just a FYI, all of these examples that I'm using today utilize ChatGPT 40, the paid version, with the exception of the subjective exam assignment, which is within our LMS. So I want to get it started off, if you'll humor me a little bit, by talking about cake as a metaphor for, thanks, Kaelee, yeah, as a metaphor for utilizing AI, and just a frame that may be helpful for you when you think about AI and when it is appropriate to engage it in teaching and in assignments for students. So what is this analogy all about? And I will say this is not my analogy. This is an analogy from Mahabali, and you can see her quote there as well on the screen. But basically, it boils down to, are students expected to bake the cake from scratch? Are they expected to know how to decorate it? Are they more wedding planners? Can they outsource some of this? And so I think this is really important as we think about AI and how we are designing assignments and learning activities. Should it be used? Can it be used? And then what part of AI is maybe appropriate in the process? And doesn't matter, I guess. So I thought that was a really wonderful analogy. Does it make sense to use a shortcut or not? And do we know how to do the full thing if we truly need to? So enough about food for a moment, at least. A little bit more about my why for AI. Here are some of the things that I just wanted to kind of let you know that I think for me, and kind of how I've seen it started to see its capabilities over the last couple of years, is that it can really help us perhaps move up in the learning taxonomy. So thinking about Bloom's taxonomy, I think I see students often get stuck at the bottom especially when they're studying on their own. They're in that learn and remember, and they don't always know how to go forward. And so I want to give you a few examples of that. So I think it does remove, to some degree, for students and us also as educators, takes away perhaps some of the excuses for not going deeper and not maybe having the clinical reasoning or the clinical application opportunities, and time perhaps being one of those big reasons that we don't get there. So I feel like it has a great opportunity for us in that sense. I think that the guided use of AI, so it can't, not just a free-for-all, but a guided use of AI can incentivize intentional practice, which has already been mentioned. It's really important for clinical reasoning. It's really important that our students have tons of opportunities for intentional practice prior to clinicals and, of course, prior to practice, PT practice. And a valuable structure and layering can be provided by AI. And I think that in itself can help maintain student motivation for learning and perhaps even prevent burnout, which is something that I'm interested in on a research level. I think that it can help with reflective practice, as Kathleen mentioned, that it can help have that continuous feedback loop where students may be good at reflecting, or I know are likely requiring them to reflect in a variety of ways, but some are better at it than others, right? And some take it kind of that full picture and some don't. And so I feel like it can be helpful for that, which we know is a part of that master adaptive learner process, which has already been mentioned. I think that it has the potential to decrease perception of busy work as well. Again, if we're kind of getting down to perhaps speed up the things that maybe are more background or students may perceive as more boring at times, and really get to kind of the meat of, maybe if we look at the top of that creating that plan of care, that big picture thing, right, for the patient, evaluating, of course, the situation. So again, kind of with the idea to get to the top. And then last but not least, which I think is really important and something that I've noticed for myself, is that I think it has the potential to decrease instructor bias. We know it perhaps we know it has its own cultural biases, and that those things are always things that we have to navigate. But I think when I am giving feedback, especially written feedback, I think it may allow me to give more feedback and more objective feedback. So, it makes me more efficient as well. And we know timely feedback is really important. So I just wanted to throw that out there as an idea, because I know we hear a lot about, for good reason, we hear a lot about the bias of AI. Okay, I want to dive into the first example here, and some of this has already been mentioned to some degree, so I'll move through this fairly quickly so that we have time to get to the other examples. But I want to talk about an individualized study plan, again, with that clinical reasoning focus. So here you see that, and I guess here's one thing I think is really important, and one thing that I hear from students and faculty as well, is that, if we're using AI, where is it getting the answers? I hear from students that they don't want to use it because they don't know where the answers are coming from. And I think that's really valid. And from faculty, we don't know always its references, especially within the unpaid version. It's not as easy to access those and kind of verify. So I think one thing that I would suggest for students, and what I used in this example, is that I fed it the information, the reference that I wanted it to use. So we have, through our library, we have access to a variety of resources. This is one of them that we utilize as a recommended text within the course that I'm teaching this semester in Ortho 1 course with first-year students. So we can download PDFs of the chapters of this and feed it into AI. And actually another faculty member actually has verified with the publishers, and this is okay, and to make podcasts and those things. So again, like, we've adopted these texts and we're utilizing them, put it in there, and it gives it that reference point so that we know where the information is coming from, and we know that it is valid, at least according to the textbook, right? So this is chapter 26 of this textbook, and I asked it to create a study guide, and you can see kind of what it came up with. Really great, hit a lot of topics. So then the next point would be to make a formative quiz, which is fantastic for students, just to kind of get some exposure or to review previous knowledge that, they should, and coming into the course that I'm teaching now, they should have a lot of this from their anatomy, their biomechanics courses, but I noticed they need refreshers, right? And so utilizing formative quizzes is something that I use in my course, but I also encourage them to do as well. And so here's an example of how AI can help with that, again, using that same reference. And it came up with, I asked it to do 10 questions, and these are a couple examples that it came up with. The first one I think is pretty straightforward and easy. The second one was, I thought, much more difficult, about the position of the foot, and more complex, higher difficulty level, more things to consider, and I thought that was wonderful. So then my second prompt is to, where exactly was this in the text? Because I actually wanted to go back and look at this myself as I saw this question that it came up with. And I also wanted it to provide rationales, which I think is really helpful for learning. So it was able to tell me the exact location, the page on the PDF, which I think is fantastic, because that's an example of a way that it can help us speed up even our processes. So on to the next. Then it actually asked me, because again, this is that back and forth with the generative AI. It asked me, do you want to make flashcards? And no, I'm trying to, move on from that. I want to move up in the taxonomies. I want to go to the case-based scenarios. And so, yeah, I was so excited when it asked me that, because I hope that's what my students choose if they're using this. And I said, yeah, give me a few cases, give me a space where I can put in some answers and actually practice, and then give me feedback on what I give. And so this is what it came up with. It gave me 3 cases of different topics. This was probably more the and one of the easier ones, perhaps, or one of the more familiar ones. So with the acute ankle inversion sprain. And then you can see at the top here where I put my ideas in, and I just did this in like 30 seconds. I didn't spend a lot of time on it, and I just wanted to see what would it come out with, right? So then it tells me, hey, great start, Dr. Morris, which I thought was a little funny how it said that. But anyway, and then case 1 review, going through those objectives, going through the treatment priorities. It highlighted the things that I considered, and it also gave me additional options to consider, which I think is really fantastic. We want our students to come up with something, but we know that, and even like when I come up with these things, we're not always going to consider all the options. So I think this is another good example of intentional practice and ways that they could use it for preparation, for practical exams, for clinical experiences, those types of things. And then it gave me some overall feedback, and it did link it back to even evidence-based practice, which I thought was fantastic. All right. Then, this really got me thinking. What if over the course of the semester in my course, a student took all of the cases? I provide a lot of cases throughout that are optional, just to have more exposure for them to engage. And what if they took those and put those into AI and they tracked them across the course of the semester? Could it really help a student identify, gaps, strengths and weaknesses? Where do they need to focus, and come up with a plan for improvement with those? And yeah, it can. And so that longitudinal feedback, I think, is potentially a really valuable aspect of this, and even a competency map. So I want to show you a few of these briefly, just what it's capable of, I guess. So it can show those clinical reasoning strengths, focus areas, and if you look at the bottom, the optional things, it can create that map. It can even tie it to PT education frameworks like KSAs, which is something I've experimented with, and it's pretty cool. Here is an example that I wanted to share with you about an OSCE practice or a mock practical. And so it says to me, if you can give me a rubric, I can come up with more mock cases, video scripts, rubric aligned with cases that really relate to that. And I can even score your performance based on that rubric, like a faculty might, which is fantastic prep. It's not going to replace me. I mean, they're still going to have to come and pass the exam, right? But it gives them that really intentional graded practice. And that's really what I wanted to kind of show you its capability to do. This is an example of that personalized improvement plan that is suggesting and kind of what to maybe target. It comes up with progress, the interventions, which is often an area where I know students need more practice. And so it was kind of cool to see that it actually suggested the progressions as something for them to target too. And in my course, I use this exact example of like phase 1, 2, and 3. So this is perfect. And of course, it aligns with the text, so it makes sense. And then just real quick, the example of this competency map snapshot, which I thought was just kind of mind-blowing in a way, to think about a student utilizing this even for that individualized purposes across a curriculum, not just within a single course or a single semester, but again, just as they're thinking about prior to going out to clinical, are they ready? What do they need to kind of brush up on or come back to? And of course, before board exams. So I'll go through this next example fairly quickly because I think you may be more familiar with this one. And then I want to go on to the OSCE example, which I think could be really exciting. This one is subjective exam. This is what is available to us right now within our LMS. And so wanted to give you some examples of what you need to input if you wanted to use it like this. So in this example, we utilize this as a formative low stakes activity. Basically, they got points for just doing it if they completed the assignment. We weren't necessarily grading their exact performance or what they put in. And this is our first time using it, so I think that was important too, to kind of have it as a low stakes formative. The learning goals are really for them to get practice with subjective exam. These are first year students, and there's a variety of experience levels with clinical interactions. And we want them to identify this. This was actually an application utilized for the course that they have in this semester for physical agents. And we wanted them to identify contraindications for an agent. This is the case that was utilized. We utilized an existing resource that we have and students have, which is PhysioU. And I'm sure a lot of you are familiar with this, but it's a subscription-based resource that we utilize as a required text. So they could even go back to the case in PhysioU if they wanted to dive deeper. So this is where it came from, and these were the instructions to students. And we gave them some prompts and let them know up front as well that the goal here is to screen for a safe application of, in this example, cold and heat. The AI persona was created, and this is Max, is who the AI persona was in 3rd grade. His detailed case information was provided to AI, and on the right-hand side, you see, I think what is important is giving it some ideas about emotions and perhaps how that person may be feeling. So we told it Max may be frustrated about wanting to get back to skate, and his mom might be cautious about him going back to those things. And also giving it a frame of specific goals beyond just the goals for the assignment. Students need to be able to navigate treatment options and especially consider contraindications as part of the specific goal for this one. We noticed in this that if it's not given these specifics about kind of their emotions or their personality, that it will fill that in, and it may not always be, it may or may not always be what you're hoping. And interestingly, we noticed even across different groups, because we grouped students together for this, that depending on who is engaging it did different things, even when given the same information. And that's kind of the nature of generative AI, right? And you just need to be, I think, prepared for that on this side of things and as the faculty member. So this was a text exchange or a chat, and you can see just back and forth here. Some pros and cons to this. I think it can be quite long. I do think it may fit what some of our students prefer as utilizing chat or be accustomed to, maybe a majority of them. What I'm hoping for to see soon is the audio video version of this. We know that other versions of AI are capable of that. Even ChatGPT, the paid version, can do that for us. But this is what's available to us currently in our LMS. So I actually took the transcription from that interaction, and I asked AI to take and highlight the clinical reasoning and ask it if it achieved the goals. Oops, sorry about that. If it achieved the goals of assignment, and it was able to kind of bring that down. And it said, yes, it has. The student had excellent clinical reasoning. And if I, just as another disclaimer, I always redact student information anytime I put something like this in here. And I just want you to know I do that throughout. So then this got me wondering, how did it know it was excellent clinical reasoning? Because we didn't tell it. Like, nobody told it that. So I asked, what did ChatGPT use to decide? And so I asked it, and it told me some things, like it uses the Guide to PT Practice, clinical reasoning models, Bloom's, APTA core competencies, CAPTE standards, all really great stuff, right? But then I thought again, what if I fed it a framework? And so I gave it a few frameworks that, are available to us. And like the CRAT, for example. And I ask it to utilize those resources, and I wanted to know what it could do. And it says, yeah, I can utilize the CRAT rubric to rate the student and give that targeted feedback. All right, in the time I have left, I want to just relatively quickly go through another example for you. This subjective assignment that students did was earlier on, and they did it kind of throughout this actual semester in the course. And it gave them a lot of good low stakes practice. And then we had at midterm time, we had an OSCE, objective structured clinical examination, in 3 different courses came together to do this. And they had a simulated patient interaction with a standardized patient actor. So it was a simulation of sorts, and the students recorded their interactions to go back and reflect on. We wanted them to watch their recording again and reflect, and we gave them prompts. And so I was curious, we didn't do this, but I was curious kind of how could AI have even helped with that? So I wanted to ask it, and you can see my prompt, if I gave you a transcript from the OSCE, in which I did, again, redacted, of course, for the patient information, or excuse me, the student information. Can you give me insights and feedback specifically on clinical reasoning and incorporate the rubric, which also highlighted clinical reasoning in some of the objectives? So I gave it the rubric and I gave it that transcript from the recording, which was super easy to get as a downloaded file. And it gave me this, just as a few examples, and it rated, this was from a particular student, strengths and suggestions for improvement, which were spot on. These are really great recommendations. You know, if I went back through this transcript, I rewatched this, I wouldn't get all of this feedback. I wouldn't come up with all of this for that student, but it's highly valuable. And then it can come up with an overall clinical reasoning rating and improvement plan. So this was really nice. And then it also asked, which I just loved. I love some of its suggestions. Would you like a custom reflection worksheet? I hadn't told it anything about the whole point of this was for reflection. And of course I said, yeah, I want a guided reflection. That was actually part of what we had our students do. So just to kind of summarize things and wrap up, I hope that gave you a taste or a flavor for what, you know, is possible. I think some low-hanging fruit and then some kind of potential to get your minds churning. Some of my golden nuggets are, and things that I didn't really have time to go into, but I think it's super important to understand student feelings towards AI and how we choose to utilize it. I will say one of my lessons learned from last year in this course was going through some examples in front of the course, and then at the end reading the course evals and students saying they hate that idea. They don't want to learn from ChatGPT. They only ever want to learn from the instructor, which, you know, in part makes me feel good about my job security, but on the other hand, I know they're probably missing out, you know, on some opportunities. So understand your students' feelings toward AI. Do a pilot or an optional opportunity so that the ones that want to engage it can, and the ones that really, you know, are not there don't have to. And then this is where I think we have a lot of opportunity. Students need guidance. They want guidance. They need coaching. And I think this is a huge gap that we need to step into. So my next step is to start piloting small group coaching sessions related to specifically course content. So it's very, you know, applicable to the student right then and there for the use of AI. And it'll be optional, not graded, just simply help you navigate AI. We know students have access to it, so whether or not we like it or dislike it, we really need to start engaging it. And our patients will be, just like they do Google, they're going to be utilizing it. And this is I've got just an image for you of a journal where patients are using ChatGPT to help interpret their information. And so that's just what's next. A few resource suggestions for you and references as well. And that's the end of my presentation. Thank you all.
Thank you so much, Scarlett. You've given us so many wonderful examples.